You take it every single morning, you drop it into your palm, swallow it with your breakfast, and you feel good about it, because you've heard for years that vitamin D is essential, that most people are deficient, that seniors especially need to supplement, and all of that is true, but here is what almost nobody tells you at the pharmacy window, and what your doctor almost certainly has not explained in any detail during a routine appointment. There is a version of vitamin D supplementation that is actively harming you, not helping you, harming you, and the research suggests that a significant majority of adults over 65 who are currently taking vitamin D are taking the wrong dose, the wrong form, or the wrong combination, and creating a slow, silent problem inside their bodies that looks and feels like nothing until it becomes something serious. I'm Dr. Sarah Mitchell, and this channel exists for exactly this reason, to take the research that sits inside medical journals and translate it into information you can actually use. If you haven't subscribed yet, please do that now. We cover topics like this every single week, designed specifically for adults over 60. Now let's get into what the vitamin D mistake actually is, why it matters so much after 65, and exactly what you should be doing instead. First, let's establish why vitamin D became such a widespread recommendation in the first place, because the science behind it is real and important. Vitamin D is not technically a vitamin. It functions more like a hormone. Every single cell in your body has receptors for it. It regulates calcium absorption in your intestines. It supports immune function. It plays a documented role in muscle strength, mood regulation, and bone density. A genuine deficiency in vitamin D is associated with increased fracture risk, higher rates of depression, weakened immune response, and emerging evidence links chronically low levels to cognitive decline in older adults. And the deficiency problem is real. A 2020 analysis published in the journal Nutrients found that approximately 35% of American adults are vitamin D deficient. In adults over 65, that number climbs significantly higher because aging skin produces vitamin D from sunlight far less efficiently than younger skin. The recommendation to supplement makes complete clinical sense. The problem is not the recommendation. The problem is how it gets implemented. Here is where the mistake begins, and this first part surprises almost every patient I walk through it with. There are two forms of vitamin D supplement on the market: vitamin D2, also called ergocalciferol, and vitamin D3, also called cholecalciferol. They are not the same, they do not behave the same way inside your body, and yet they sit side by side on the same pharmacy shelf with nearly identical packaging, and the difference is almost never explained to the person picking one up. Vitamin D3 is the form your skin synthesizes naturally from sunlight. It is the biologically active form your body recognizes and processes efficiently. Vitamin D2 is derived from plant sources and fungi. Your liver must convert it before it becomes usable, and that conversion is significantly less efficient in adults over 65, because liver function slows with age. A systematic review published in the American Journal of Clinical Nutrition analyzed multiple head-to-head trials comparing D2 and D3 supplementation. The conclusion was consistent across studies. Vitamin D3 raised blood levels of the active compound roughly 87% more effectively than the same dose of D2, nearly double. The effectiveness from the same pill taken the same way every morning. If you are currently taking a vitamin D supplement, stop for one moment and look at the label. Does it say D2 or ergocalciferol? Or does it say D3 or cholecalciferol? That distinction alone could explain why your vitamin D levels haven't moved on your blood tests despite months or years of supplementation. Comment below right now and tell me D2 or D3. I want to see what our community is actually taking, because this confusion is far more widespread than most people realize. But the form issue, as significant as it is not the most dangerous part of the vitamin D mistake. The most dangerous part involves what happens when vitamin D supplementation goes too far, and this is where I need you to stay with me very carefully. Vitamin D is a fat-soluble vitamin. That distinction matters enormously. Water-soluble vitamins like vitamin C are flushed out through your urine when you take more than your body needs. Fat-soluble vitamins, including D, E, A, and K, are stored in your body's fat tissue and liver. They accumulate, they build up over time. And when vitamin D builds up beyond what your body can safely manage, it creates a condition called vitamin D toxicity or hypervitaminosis D, and the consequences are not minor. Vitamin D toxicity works through a very specific mechanism. Vitamin D drives calcium absorption. That is one of its primary jobs. When vitamin D levels in your blood become excessive, it drives calcium absorption into overdrive. The result is a condition called hypercalcemia, too much calcium in your bloodstream, and hypercalcemia. In adults over 65 creates a cascade of problems that are frequently mistaken for other conditions entirely. Nausea, fatigue that doesn't respond to rest, confusion, muscle weakness, constipation, bone pain, frequent urination, and most seriously, calcium deposits forming in the soft tissue of your kidneys, a condition that can progress to kidney stones and permanent kidney damage. A 2019 study published in the journal Annals of Internal Medicine followed a large cohort of older adults taking high-dose vitamin D supplementation. They found that adults in the highest dose group, those taking 4,000 international units or more daily, had significantly worse bone density outcomes than those taking moderate doses. That result stopped researchers in their tracks. More vitamin D was actually making bones weaker, not stronger, in those patients. The mechanism behind that finding is still being studied, but the most supported explanation involves high-dose vitamin D disrupting the delicate balance between calcium depositions in bones versus calcium circulating in the bloodstream. Let me tell you about Patricia. She was 72 years old and had been doing everything right by every measure she could think of. She exercised regularly, ate carefully, took her medications as prescribed, and had read extensively about senior nutrition. She had started taking 5,000 IU of vitamin D3 daily about 2 years before I met her because she had seen it recommended in multiple wellness articles online. Her doctor had never specifically discussed her vitamin D dose with her. It was just something she managed herself, like most people do with supplements. When she came in complaining of persistent fatigue, increasing confusion, and what she described as a mental fog she couldn't shake, her family was genuinely frightened. Her primary care physician had already tested her thyroid, normal, run a depression screening, inconclusive, checked her B12, borderline but not critical. Nobody had checked her vitamin D level or her calcium level. When we ran a comprehensive metabolic panel alongside a 25-hydroxy vitamin D test, her vitamin D level came back at 112 nanograms per milliliter. The safe upper range for adults is generally considered to be 100. Her calcium was elevated. She had been quietly building toward toxicity for months. Her supplementation was stopped under medical supervision. Her calcium levels normalized over approximately 8 weeks. Her mental fog lifted noticeably within 6 weeks. Her energy returned. Patricia had been taking a supplement she genuinely believed was protecting her health, and it had been doing the opposite for nearly a year, without a single obvious warning sign until the symptoms became impossible to ignore. Now here is the third layer of the vitamin D mistake, and this one involves a nutrient most people have genuinely never connected to vitamin D at all. Vitamin D does not work alone inside your body. It works in direct partnership with vitamin K2. This is one of the most important and least discussed relationships in all of senior nutrition, and the absence of this knowledge is creating real harm in older adults every single day. Here is the mechanism. Vitamin D increases your body's absorption of calcium from food and supplements. That calcium then needs to be directed somewhere. Your body has a choice. It can deposit that calcium into your bones, where it belongs and where it strengthens skeletal tissue, or it can allow that calcium to deposit into soft tissue, blood vessel walls, heart valves, kidney tissue, arteries. Vitamin K2 is the nutrient responsible for activating the proteins that direct calcium into bones and away from soft tissue. Think of vitamin D as the delivery driver that brings calcium to the door. Vitamin K2 is the traffic director that tells it whether to go into the bone or into the artery wall. Without adequate K2, the calcium that vitamin D is efficiently delivering has no proper direction. A landmark study published in the journal Thrombosis and Hemostasis followed over 4,800 adults and found that higher vitamin K2 intake was significantly associated with reduced calcification of the arteries and lower cardiovascular mortality. A separate study published in Osteoporosis International demonstrated that combined vitamin D3 and K2 supplementation produced significantly better bone density outcomes than vitamin D3 supplementation alone. And here is the critical problem. Almost no standard multivitamin contains meaningful amounts of vitamin K2. It is an entirely different compound from vitamin K1, which is found in leafy greens and included in many supplements. K1 and K2 have fundamentally different roles in the body, and K2 in particular is found in very Limited food sources, primarily fermented foods like natto, certain aged cheeses, and some grass-fed dairy products that most Americans consume very rarely if at all. So what does this mean practically? A senior taking 2,000 or 3,000 IU of vitamin D3 daily without sufficient K2 in their diet or supplementation may be efficiently absorbing calcium without directing it properly. The cardiovascular and kidney implications of this over years are significant and increasingly well documented in the research literature. One important note for anyone on blood thinners, particularly warfarin: vitamin K in any form interacts with warfarin's mechanism. If you are anticoagulated with warfarin, do not add any vitamin K supplement without an explicit conversation with the physician managing your anticoagulation. This is a non-negotiable safety requirement. So let me pull this all together into exactly what you should do, because none of this is meant to frighten you away from vitamin D. Appropriate vitamin D supplementation in seniors is genuinely important. The goal is to do it correctly. Step 1. Get your vitamin D level tested before adjusting anything. Ask your doctor for a 25-hydroxy vitamin D blood test at your next visit. The optimal range for adults over 65 is generally considered to be between 40 and 60 nanograms per milliliter, not below 20, not above 100. That middle range is where the research consistently shows the greatest benefit and the lowest risk. This test is inexpensive, widely covered by insurance, and gives you an actual baseline to work from rather than guessing. Step 2. Check your current supplement for D2 versus D3. If your current supplement lists vitamin D2 or ergocalciferol, discuss switching to D3 with your doctor or pharmacist. The bioavailability difference is significant enough that it is worth a 5-minute conversation. Step 3. Do not exceed 2,000 IU daily without your doctor's specific guidance based on your actual blood level. The recommended dietary allowance for adults over 70 is 800 IU daily. Many physicians recommend 1,000 to 2,000 IU as a reasonable supplementation range for seniors without tested deficiency. Doses above 4,000 IU daily should only be used under medical supervision with regular blood level monitoring. The high-dose supplements sold in wellness stores, the 5,000 and 10,000 IU capsules, are not appropriate for unsupervised long-term use in adults over 65. Step 4. Consider discussing vitamin K2 with your doctor. If you are taking vitamin D3 and do not consume fermented foods regularly, ask whether adding a vitamin K to supplement in the MK7 form, which has the longest half-life in the body, makes sense for your situation. A typical evidence-supported dose ranges from 90 to 200 micrograms daily. Again, this conversation must happen with your physician if you are on warfarin or any anticoagulant before you take any action. Step 5. Have your calcium level checked alongside your vitamin D level. A comprehensive metabolic panel, which most doctors order as part of a routine annual blood draw, includes serum calcium. If your vitamin D level is high and your calcium is trending upward, that is an early signal worth addressing before it becomes a clinical problem. Vitamin D supplementation is not dangerous when it is done thoughtfully. The mistake is not taking it. The mistake is taking it blindly, at doses set by wellness marketing rather than your actual physiology, in a form your aging body processes poorly, without the cofactor that makes its most important job work properly. Patricia got her answer. Her health stabilized. She still takes vitamin D today, 1,500 IU of D3, paired with a K2 supplement, at a dose her physician and her blood work together determined was right for her body. Not the internet's body. Her body. That is exactly what evidence-based senior health looks like in practice. Comment below with one of these 3 responses so our community can see where people are starting. Comment checking my label if you're going to look at your current supplement today. Comment never knew about K2 if this cofactor connection was new to you, or comment getting tested if you're going to ask your doctor for a vitamin D blood level at your next visit. I read every comment and your responses directly shape the topics I cover next. If this kind of honest, research-backed information is what you've been looking for, subscribe to this channel. Next week I'm covering 5 specific warning signs on a routine blood test that your doctor may glance past but that can predict serious cardiovascular risk 3 to 5 years before symptoms ever appear, for adults over 60. That window of early detection is everything. You will not want to miss it. I'm Dr. Sarah Mitchell. Take good care of yourself. You now have the information to do exactly that.